Okay. So this week,
I've been running. Can you tell?
I have to. You missed the beginning part. I was like, they caught me in the kitchen. I was fixing dinner. And then I just left. So
we'll get dinner later.
Yeah. Well, clearly I'm still in my office, so I'm a long way from dinner.
I gotta get all my little people bathed and in bed tonight. So my middle child has a field trip tomorrow.
Mm-hmm.
Okay. I'm gonna pull up the stuff. Where are we? Labor Management Relations.
Mm-hmm.
All right. So our activities for this week are team discussions of experiences with labor management relationships, collective bargaining unit, and your responses to the 2 questions within that graded forum piece. So
there's no graded forum though this week, right?
No, it's just the discussion here.
Yeah.
Oh, it is? I was thinking there was a graded forum this week.
We're done with graded forums.
Oh.
I think I counted it. There's like 4 activities left or something like that.
Yeah, I think we just do a discussion of these questions and post it for her to view.
Or the Zoom meeting. I think that it's just post your Zoom meeting.
Yeah, for her, yeah.
Yeah.
Oh, okay.
Same thing we've been doing.
Yeah. We just don't have to do anything else other than this discussion.
Right, that's my understanding as well.
Yep.
I will not have too much firsthand experience to contribute to this discussion. I've not been in an organization where we had a lot of union discussion. My husband deals with it in manufacturing more than we do, but.
Well, it's interesting that this is what we're talking about, because I did, we had it was the Youth Leadership Surrey County group came through yesterday at the hospital, and that's one of those things that gets pushed over to me. And so they had a flight nurse from Wake Forest Baptist that was there, and he was talking about air care and how they function. And so I don't know how much you all know about air care, if you've ever seen an air care hospital, how small they are, but they basically fly with 3 people on the air care team.
Mm-hmm.
It's a pilot, an RN, and a paramedic.
Yep.
So I had never thought about it before in all of my years, but he was kind of telling us what happens when they go to a scene. And I asked him, I said, I've never thought about it. I said, but does the pilot have any other role other than flying the plane? And he said, no. He said their union would not allow it.
Hmm.
He said they will not even allow them to like pick up a bag or a jacket or something that's there at the scene. They can't touch it. Which is,
well, they're not medical. Their only role is to fly that helicopter
right.
or plane or whatever.
So it's, I mean, that's.
It's weird.
Yeah, well, I was going to say, but from my perspective, they're human. So while they might not provide medical care, I mean, I might not be a nurse, but I can pick up someone's jacket for them and bring it.
I know, yeah.
That's just decency.
Yeah, and he said that they have some. He said, and they know who they are. He said that they have some that will, like, if they've got a medical bag out there or something, that sometimes the pilot will grab it for them. He said there's some that are adamant. They will not touch anything. They are strictly there just to fly that helicopter. And I thought that was just really, really interesting, an interesting take on it.
Right.
Well, I will say I don't technically have personal experience with a union. However, at this very moment, I am involved in a lawsuit with all the other employees that worked. See, in 2011, I worked at a local, I'm not going to get in the history of it because it'd take forever, but I worked for a managed care organization, and I worked for a company called New River Behavioral Health Care in Boone. It was based out of Boone, And we provided the same sort of thing that I work for now. And I have told Dr. Ross in one of my emails, I said, I see why finance is so important, because when the CEO of the company retired, a new CEO was elected, and she was a therapist. So we had no COO. We only had a CEO and a CFO. So you didn't have that operating person. And she was acting as the CEO and had no financial understanding whatsoever. And I don't remember exactly how it transpired, but we were a state agency and had signed an interlocal agreement with 5 counties: Wilkes County, Ashe County, Allegheny County, Watauga County, and Avery County. And because we were an interlocal agreement, the counties took on responsibility of, if something happened, they would be financially responsible for whatever could occur. And at the time they signed it, why would anything go wrong? Guess what? It did. September 2011, we have a big meeting and found out that New River had lost their Medicaid contract and had no money to pay the bills. So, and we were a 20 or 30 year organization of people that live in Watauga in this area know who New River Behavioral Health Care was. So it's not like it was just some podunk organization. So anyway, we had to shut down. I mean, the last 2 weeks that I worked there was no toilet paper. I mean, you literally had to bring your own toilet paper. The garbage wasn't collected because we hadn't paid the garbage bill. I did get paid for my last paycheck because the counties, the 5 counties, kicked in and paid. They put funds in to pay those payments and make sure everybody got paid. Here's where a lawsuit comes in. They agreed to pay any outstanding debt if that was to ever occur, okay? Well, there was plenty of debt outstanding when the company shut down. One of the big factors was we were not allowed to take any annual leave or anything of that nature that last month. That, and Jonathan, I'm sure you understand this. If you were to leave your agency or your school, if you had any annual leave left over, they'd have to pay it out, right?
Yes.
Your sick
Annual
leave
leave pays out. Sick leave does not.
does not. Right. So I had as 240 some hours of annual leave. That is a significant amount of change in money.
Yeah.
As well as every other employee there. And we were told we would receive it. We did not. And so we all are involved in a lawsuit now because the counties technically owe every employee their annual leave balance. And it's been 5 years.
Yeah.
And I just brushed it aside that would never happen. But actually, there's a judge that's listening to it right now. And lo and behold, he believes that we are owed our annual leave. So I'm actually having to submit all these documents all of a sudden. I'm like, wow, that's kind of cool. But it's weird because you have this company that told you not to do this and don't take your time off or anything like that. We'll pay you at the end. And I mean, we're talking about $5,500.
Yeah.
Yeah.
So, and like I just went to ethics training last week, and they were talking about fund balances. And of course, one of the things she said was, and we have to have so much left in a pot of money to pay out annual leave if we imploded or whatever. So, I mean, it's policy, and they didn't follow through on their policy. That's not a union issue, but it is a labor issue. We found it interesting, though, the wage and labor laws, they would not touch it because of the fact that it was an interlocal agreement. They agreed that we were owed the money, but they couldn't agree on could they make the county commissioners pay it. So it's a weird feeling, but there you go.
I thought it was interesting. I don't know if you guys had a chance to read that little bit about the assignment tonight with the nurses.
Mm-hmm.
But it was in Pennsylvania.
Mm-hmm.
I did. Yeah.
And I thought it was interesting. My son's girlfriend goes to school in Pennsylvania.
Ah.
And they are in the middle of a teacher strike also. So I thought it was interesting that there are multiple, over the past probably 5 years, healthcare and education strikes in Pennsylvania. So it sounds like they're having a lot of issues.
Yeah.
Government, and because they were the state schools were on strike. So they said it would not affect Penn State, Pitt, and Temple, but the other state schools the teachers were on strike.
Mm-hmm.
Are there a lot of unions? Are there a lot of unions in North Carolina?
No.
Where?
I wonder if we had the same discussion in another state, if the
Would it
answer
be
would be the same as what we'll give to answer these questions.
Yeah,
Because we're in
Yeah.
a state where we don't have a lot of it, and I grew up in a household where it was really taboo. We didn't do it, and we didn't talk about it, and we didn't encourage it. And my dad worked for R.J. Reynolds, and they were and that was a one that was constantly dealing with threats of unionization. So that was a big deal. So from the management perspective, they had to, within the law, do everything that they could to prevent union activity. So my husband deals with it now in manufacturing as well.
Yeah.
Well, that's why I'm in North Carolina, because we lived in Indiana when I was a kid, and because of the unions, my dad worked for International Harvester, and they made Dad go on strike several times, and he didn't want to go on strike, but you had to because you were part of the union.
Right.
And then International Harvester shut down, and he was unemployed for 6 months and got a contract job in North Carolina, so that's why we're here.
Yeah.
I mean, and then of course everybody has seen, what happened in Detroit with auto unions. I mean, I think a lot of people blame unionization of the automobile industry on the demise of Detroit.
Mm-hmm.
I think that probably when unions started, they had a place.
They did.
I think that you had poor working conditions. You had, environmental hazards that, that the government's been involved in now. I think maybe they don't have the same place they used to have.
Yeah.
My husband, he's in manufacturing, and they have plants in lots of different states, and they have some out of the country as well. So the companies here are not union, but the companies in some of the northern states, in the Chicago area or the Wisconsin area, some of those are unionized. So it's a little bit tricky when you have one company, but they have unions in some plants because they've acquired plants at different times. And if the union's already there, you're kind of stuck with it. But the Chicago plant had a pretty active union, and they were threatening strikes. And so they shut the plant down.
Right.
So, which legally they can do. I mean, they can close the plant. So,
with North Carolina being like a lot of southern states are right to work states, so you're not required to join the union.
Yeah, North Carolina is, yeah.
But I think, like we said earlier, as far as it makes a difference when if you're in a certain job, you're required to join the union up north, or
Yep.
If you join the union, you're required to participate no matter what.
Pay the
They
dues.
decide to go on strike and stuff. Because I think, what was the question that was asked? Like,
It asked two questions. One is, in your opinion, do you think healthcare employees should be allowed to strike over wages and benefits? And explain your answer. That's the first question.
I don't. I mean, I disagree with it. I don't think they should. I don't think they should be able to strike. I mean,
It can be harmful.
well, and you think about the oath you take as a healthcare professional, and
Mhm.
and it's
Yeah.
do no harm to the patients, and so, I mean, by default, by not taking care of the patients not working, I mean,
You're putting them at risk. Yeah.
putting them
Yeah.
at risk, and so.
well, I've got one of the guys that I teach with, his wife is a nurse, and she has gotten certified in a number of northern states as well,
Mhm.
just because of the strikes and stuff that go on.
Yeah.
Because when those strikes go on, they'll fly in nurses from other areas and
They get
pay them a
really well.
ridiculous price.
Yes.
Like she said, one state was going to pay her almost $80 an hour.
Yeah.
God.
It is a ridiculous.
And they'll usually pay for where they stay as well. They'll pay all their expenses.
Right. In addition to all that. And so, I mean, that, to me, that costs, and it's like it said in the article we were reading, as far as that costs the organization a lot more money that could be put forth back to raises or benefits or stuff like that.
Mhm.
What
But
they're arguing about.
right. Well, my question would be then, if they're not allowed to go on strike, and what would be the process for raising issues with wages and things like that, besides just answering questions on an employee satisfaction survey?
Yeah, and I mean, I see it. I guess I
Not
don't
much.
see it day in and day out. I guess I see it indirectly. And
Mhm.
I know Dina and I have talked about it before with nursing shortages right now, that I think that a lot of hospitals are, you're seeing a shift. And it was probably 10 years or so ago that it happened. And it's basically that, I think nurses felt like they were not being compensated enough for what they were doing. And so, they go somewhere else and they start making more money, and it just is kind of a domino effect from there. You have one leave and then another one leaves, and they basically start, jumping around, finding the highest offer. And here regionally, more so than in some places, I would think, but they've got a lot of different options. I mean, they've got a lot of different options just as far as hospitals go, because they're, here in this part of the state. And Jonathan, I know you're not here, but Heather and Dina are. I mean,
Mhm.
we've got big academic medical centers. We've got,
Mhm.
big tertiary care hospitals. We have small community hospitals, and there's a multitude of them. I mean, and then you've got the private sector where
Yeah.
you can go
Yeah.
and make even more money. So,
Yeah, I know a friend who has a nurse, whose mom's a nurse, and she likes to move around. And she's probably she's worked at Hugh Chatham, she's worked at Wilkes Regional, she's worked at Novant. Right now she's at Baptist.
What's happened is a lot of them have figured this out. They know, they know they can jump ship. And I'm not agreeing or disagreeing with it, because I have a tremendous amount of respect for nurses. I think that's a very difficult job, probably one of the most difficult jobs you can have within healthcare. But they figured it out, though, and they've figured out how to work the system. And I see it, day in and day out, with local nurses that are even coming in now as travelers through companies, and they're getting paid, crazy money to come in and work, just like Jonathan was talking about. I don't think they're getting paid $80, but
No, but it's significant. Radiology. When I first went into breast imaging, we had 3 contract techs at the breast center. And all 3 of those, their room and board was covered as part of their contract, plus they were making about $10 an hour more than the staff.
Yeah, and
So
that causes problems. That
Yeah,
causes
yeah.
resentment. It causes resentment within the
Yeah.
organization because
It's prohibited now within Novant.
yeah. So it's like, why are you paying them more? I've been here for 20 years, and you're paying this person who knows nothing about it. So, I don't know what the answer is. I think for us, I think we are experiencing growing pains. I think we're emerging upon a cultural shift. I mean, where we're going to have to. I think we're going to have to pay people more. I think we just are. I mean,
Well, I think in Hugh Chatham may be a good example, being a community hospital. I think historically, people that worked there lived there.
Yeah.
And they grew up there. They weren't people who moved into the community. They grew up there, they got jobs, and they lived there, and they raised their families there. But now, and now we're seeing these shifts, and not just in healthcare, but in lots of organizations, business, where people may not have the same loyalty to a company that they used to have, because they don't feel like the company gives them anything in return.
Yeah.
So, we don't have pensions anymore. We have 401ks.
Right.
So people can move from job to job and state to state without actually losing anything. So I think now you've got the opportunity, and you're going to see people moving to different areas, and it's not as big a deal for them to leave again. Right. So I think we're going to see a more transient population in these rural areas and in the South than we've seen in the past.
I would 100% agree with that. Absolutely.
Well, it's like what I do, we don't have a lot of turnover where I work in my county area, because the main office for Smokey is in Asheville. But in that Asheville office, we have care coordinators that will find another job within the organization and jump ship constantly. And there's several that have come back and then go back out to another job within the company even. And that hurts the patient, because then they don't have somebody that knows who they are and arrange the correct services for them. And we don't get raises.
Yeah.
Well, I tend to agree. I don't personally think that healthcare is a place where it's okay to strike. It's just, for me, that's the same as fire and police. Those are just things that we need. And it's just, I don't think it's appropriate. I think if you don't like your job, if you're not happy with your benefits, then find a new job.
Yeah.
The flip side of that is a company that is smart is going to make sure that they're competitive in their wages and benefits.
Yeah.
They're going to do market adjustments and figure out these assessments and figure out what everybody's paying, because they want to maintain that staff that they've put all this time into. They don't want a lot of turnover. It costs a lot of money.
Yeah.
So, I think that maybe that's why we're down here. We're so used to not having unions in place. It seems like things just kind of work themselves out without that influence.
Yeah, I agree with you, and it's hard. It's hard to get that message across to I think, particularly to the CFO.
Yeah, it's difficult. My husband deals with it a little bit more manufacturing, but you've got situations where it always comes up when they're having things like a lot of overtime or something that, that a group of people are unhappy about, and that's when it kind of gets going again.
Mm-hmm.
And he's went through, there were some things that I looked at that you could and couldn't do as management in that situation if there's union talk. And I remember him telling me stuff like this, what they're allowed to say and not say to employees about it. And when I pulled that list, it's like word for word what they do at his organization. Like they have meetings where they talk about, their total compensation, and and they can give examples of companies where, that were pre and post union, and what the actual difference was for employees, which wasn't, they didn't get as much out of it as what they were being promised, basically. But they have to present it in a way that it's just data, and, they don't have an opinion. But he said that when they closed the plant in Chicago, he was there the week before, and he didn't know until the day he left Winston that they were closing the plant. He's like, there's some issues with unions. They're closing the plant. They're finding out right now. So just be aware that there might be a little bit of hostility. So
yes, think.
Yeah. So he had another guy flew up for 2. Usually they would be there a week, but they flew up days. They were not wanting to be there, but he said you could tell there was a lot of animosity. The workers making comments about, they guessed that they'd be fine and have jobs because they don't work in that plant, and they'd already heard about it. So through the grapevine. But I guess that's the employer's prerogative as well. I mean, they have other options to put their plant somewhere else. So.
Yep. Well, like I said, where my dad worked was in the auto industry, International Harvester. He worked in the heavy axle truck division, and that was back in 1984. Yeah. And he was part of a union. And me and Dad would he would be forced to go on strike. And I can remember him talking to Mom and saying, "Oh, I don't like this. But if I go to work, then you're in way bigger trouble because you went against the union that you had to be part of to begin with."
Yeah.
So it was not fun.
No. A friend of mine, she did, I don't know, many years ago, there were some strikes with airlines with they don't call them stewardesses now, flight attendants. And she was a scab, basically. They hired her to come to D.C. and fly out of Dulles while they were on strike. So she would have to cross the picket line every day to go in to take somebody's place. And she did it for just not long, just a few months, but she made a ton of money. She said, I made as much in that few month time as I made all year at my other job. So, and she had no problem with it. I mean, she's from down here, so she didn't understand the whole union thing anyway, so she was fine with it. But the other question it asked along those lines, it talked about the anti-disparagement clauses. And I don't know if you guys do that at your organization. The question is, should employers be allowed to compel anti-disparagement clauses in collective bargaining agreements? The only thing I know about the anti-disparagement clauses, we do have something like that when people are terminated. Not everybody, but when people are terminated in roles where they may be offered severance packages or benefits or something when they leave. And we don't ever hear it called anti-disparagement, but it's basically she's not allowed to talk about what happened.
Yeah.
And so that usually goes along with if you want to get your package when you leave. A lot of times what they'll also do is, as long as the person hasn't committed, some really heinous act.
Something egregious, yeah.
Right. Then they're usually offered opportunity to resign versus being terminated.
Yeah.
So that helps with future job finding. Yeah. So they can get their resignation and their benefit package and their severance package as long as they don't talk about it. So, I'm not sure. It's like I said, I don't have union experience, so I don't know if there are other ways that they can do that if they're talking about while they're employed or if it's only at termination. But I don't personally think that that's okay for the employer either. I think, there are laws to protect the employer. If I leave and I falsely accuse them of something, there are laws that protect them from that. So they can take me to court for libel or defamation. So I don't think that necessarily you need to have a clause that prevents employees from talking about something they think is inappropriate if it's true about the workplace that they left.
Yeah.
Well, and I guess looking at a different side of it, I can see, because I think ours is similar. I think we have, and I've seen it happen before, and I think a lot of the reason that they do it is to prevent litigation, and not because of anything other than the costs associated with it. And we had an instance with a practice supervisor who had falsified a document, and basically said, and it was like the bad cold that wouldn't go away. It was like it just kept and finally they did offer her a very small severance package, and it was basically in trade for signing of that documentation that she was done. It was over. She wasn't going to bring it up anymore because she was threatening litigation. And so, again, for a small hospital, I think the trade-off was worth it for them. It's in their eyes. Personally, I don't know how I feel about it.
They wanted it to go away.
They wanted it to go away.
Small places, they talk.
Really, she was in the wrong. But I guess you can kind of almost, it's not the same. It's not comparing apples to apples, but it's the same as a lot of malpractice cases that you see, where the physician or the provider really didn't, they had done everything within
that they could.
Everything that they could. They had followed protocol. But, stuff happens. So it does. And sometimes it is, for them, it's less costly to just settle it. Settle it out and be done with it. Because the cost of settling is probably, in some cases, going to be far less than if it proceeds on. In worst case scenario, if it proceeds on and you lose the case. So,
yeah.
Well, it's just like the situation I'm in with my past employer. I'm interested to see what actually will transpire.
Yeah.
Because if the county, it feels odd. I don't like being part of it, but it's a collective thing.
Yeah.
The county commissioners, it clearly, they know they were supposed to pay it, but because they're county commissioner, it was a county thing, they all 5 counties said, we ain't paying it. But now here it is 5 years later, and it's come back up, and it's haunting them again. And this time there's a lawyer or a judge that is actually listening to it. And, I'm sure they don't want to deal with it again. And there's all that arbitration and what else you can do. And I think they might enter that before it actually goes to an actual case with all sorts of craziness. I hope so. But it is, it could have been a lot easier. They had plenty of money to take care of it, but they were mad that they'd gotten snookered into signing something, so they thought.
Yeah.
Well, I think on one hand, I can see the anti-defamation clause would keep your reputation intact. People claiming things about the organization that are true, but maybe you don't want to be public.
Yeah.
But the flip side of that is, if you do that, then those things that are true are never made public, so they may not change.
Yeah.
So, if the employee did something wrong, that's one thing. But if the employee chooses to leave because they think the company's doing something wrong, that's
different. Yeah, but I guess that you can't differentiate the two, though. It's, if you do it.
Yeah.
If it's policy, it's policy.
And the flip side of that is, if the person feels strongly enough that it's wrong and they need to talk about it, they can choose to not take the packages from the company. They can leave with nothing and talk about it.
Yeah.
But most people are not going to do that.
We have an employee that left Smokey probably 2 or 3 years ago, and she now works for a provider agency. Oh my God, she hates us. And she is like, she talks bad about anything and everything that Smokey does, and she is crazy. And I'm surprised that somebody hasn't done something, but of course you don't want to get into litigation, but she's almost downright nasty, especially if you have to deal with her in a provider type relationship.
Yeah.
It's not fun.
No, we've had those situations like that when people leave, whether they're asked to leave or they choose to leave.
Yep, and she chose to leave. She took another job she wanted gone, but woo. And from what I can tell, Smokey didn't do anything to her. She just doesn't like the way an MCO works, I guess, or something.
Yeah.
You know. But she doesn't have a problem putting that money that she's making as a provider in her pocket either. From the reimbursement rates that we're giving her.
Yeah.
So, I don't know.
So, let's see. Or any other?
I think that's it on that discussion.
Yeah. If there's anything else. Yeah, and I mean, this is a.
I know this one's tough if you hadn't experienced it firsthand, or
I think it is too. I think
there was one thing that I saw when I was looking this up a little bit that I had never heard of, and it was the right to permanently replace strikers, because we were reading that you couldn't terminate them because they went on strike, but there's kind of it sounds like a loophole to that, that they can permanently replace them based on need for staff. And so what the difference is, instead of just firing the people, they can reapply for those jobs if they become vacant again, but they're still losing their job.
Yeah.
Right.
So that's kind of a little way around it. But they were saying, the one thing I was reading was saying that the threat of permanent replacement was enough to damage the whole buildup to a strike. If that kind of got out through the grapevine that they were looking at that in some cases it would reduce the chance that they'd actually go through with a strike.
Makes sense to me.
It would me.
I do know another area. one more example is my parents lived in Southern California for 5 years.
Mm-hmm.
The grocery store workers in California are unionized. So
Wow.
The people that run the cash registers there, my mom said, made like $20 an hour. I know.
Well, it's
That's how they pay $700,000 for a cottage.
Yeah.
Well, and yes. So I just thought that was really interesting. But they had a strike while she was there. They did, and I think she shopped at Albertsons, maybe it was the grocery store, and she, she's from the South, and she's like, and I just crossed that picket line.
Well, she needed her groceries.
Like, I needed shopping. Yeah, but I thought that was.
I wonder what they were striking about.
Well, it was wages.
Wages.
It's wages, and I would be interested to see the majority of the time that there are strikes. I mean, I think across
it's wages.
It's wage related. It is.
Well, that's what the McDonald's threat's been about. It's been wages.
Wages.
I mean, it hasn't happened yet, but that threat.
Yeah, and the problem with that is that McDonald's, those jobs were not created for people to have
to live on,
for careers. Yeah, I mean, when those jobs started, it was 16-year-old kids. It's like, again, you go to California and you go into an In-N-Out burger, or you go to Chick-fil-A. Even here, Chick-fil-A typically hires young college-age people
mm-hmm.
Who are, basically making spending money. They're
expecting minimum wage.
It's their spending money because they're typically in some type of program to further their education.
Mm-hmm.
So it's really interesting that, if you took a Chick-fil-A and you took a McDonald's and you compared and contrasted the workforce. Now, I mean, does that make it right or wrong? I don't know. I don't particularly think that somebody that works at McDonald's
deserves the same price as someone with more education.
I don't. Yeah, $15 an hour. I mean, I'm sorry, a CNA who is doing grunt work. I mean, again, some of the most difficult work that you can do. I mean, you are literally wiping people's rear ends and you're feeding them, and I mean,
they get paid nothing.
And they get paid nothing. They get paid nothing.
Yeah.
at all.
And you know what's really sad though? We're dealing with this right now as an MCO. We literally raised the rate that the providers are getting reimbursed significantly, like $10. Huge.
Yeah.
There are several providers that aren't
You're breaking up, Heather.
asking one penny. I know, I see that. Is it back?
Yeah, it's
Is it better?
It was kind of in slow motion.
Sorry.
Okay.
But it's really sad that we significantly raised the rate.
Sorry.
And they didn't raise the workers' rate of pay at all.
Mhm.
And they're retaining right now almost 60 to 65% of the wage. So there we go.
There you are.
Well, I think, that was the case in when I was in Chicago, maybe in the spring, I don't know, sometime in one of my recent Chicago trips, the taxi cab drivers were on strike.
Oh my gosh.
Yeah. So I landed at the airport thinking, and as I'm landing, I'm hearing people talking about it, and I said, what are you talking about? And he's like, well, all the cabs are on strike. And I said, well, how am I going to get to my hotel?
Well, I mean,
But they have so many Uber drivers.
I was going to say, but
It ran exactly like it did when the cabs were there. I could not tell a bit of difference, which is probably why the strike lasted about one day.
yeah, because
Yeah.
The rest of the world kept going.
I mean, and that's something to think about with that is, can you be replaced?
Yeah.
I mean, somebody's willing to do it, and so anyway.
Yeah.
Well, good deal. Awesome. Well, I think we've got everything covered. Do you all feel like we've
Mm-hmm.
Yep.
covered everything in our limited knowledge of labor management relations?
Yeah, I think we can stop recording.
Okay.
Stop it.